What I want to talk about today is an issue that I've been struggling with, well, more in the last few months, but really on and off for the last couple of years, and that is tinnitus and hearing loss. I have had a chance to talk to my family and my friends about this issue, but for some reason I kind of feel like if I can just get everything off my chest and get it all out there and talk it through in front of a camera to myself, it will make me feel better. I don't know, I suppose this video is kind of mostly for me. It's a way of just cataloguing my thoughts and talking through my experiences. And as I said, this is kind of just part of processing it for me. Before I start, I should say that I am actually a doctor. I work in general medicine in a busy teaching hospital. But this has got nothing to do with me being a doctor. This is from a sort of, I suppose, a patient perspective, or just as a person, a lay person. I don't have any special interest or knowledge about ears or tinnitus or anything like that, and I'm certainly not doing this video to try and push a product. And you will find a lot of videos on YouTube that tell you can cure your tinnitus with some fancy fad or newfangled medicine, and most of that is rubbish, so be very careful about what you watch. But there's no agenda here. As I said, this is mostly for me, just to get down some of my experiences and share, I guess, with you guys what I've been going through. I started playing guitar when I was probably an early teenager. I played heavy metal and electric guitar and things throughout high school, and I got my first guitar probably when I was about 16, 17, and that was a Gibson Epiphone Les Paul. Sorry, it's a copy of a Les Paul. And I've been playing music ever since, really. I've played lots of gigs. I've played in several bands, heavy metal bands, indie bands, folk bands, and music is really my life. Music is my biggest passion. It's one of the things that I get up for in the morning. It's one of the things that when I've had a bad day or I'm feeling down, music can turn me around, and it really speaks to me, and it's such a big part of my life. And so being a musician has always been something that I've kind of taken pretty seriously, and I've always kind of dove head first into music and tried to be in as many bands as I can. And I suppose just besides being a musician, in general I've always been listening to music, listening to music constantly, especially through my university days. I'd always have the headphones in on the bus, or when I was walking to lectures, or when I was back home, just listening and immersing myself in music all day long. And of course I used to put my iPod up really loud so I could really get it blaring on the bus, and as you know, that's not necessarily a good thing to do. I suppose that the other side of things to mention about music is that at university, the kind of commonplace expectation, I think that everybody did, was go clubbing. We used to go clubbing 2 or 3 times a week, every week, without fail. And that's like, university for me was like 5 years, and pretty much for most of those years I would go clubbing all the time. And the noise exposure you get in nightclubs is crazy, it's scary, it's dangerous. The level of just noise and damage that you're shoveling into your ears. And I was doing that every week, and I suppose I first started to notice that I was getting problems maybe 2 years ago. After band practices, I would notice that I was getting ringing in my ears at night time. And of course everybody has that thing where you go to see a loud gig and the ringing starts and then it settles. But I was noticing that the ringing wasn't settling, or it was taking longer to settle. It was manageable at that stage, and I think I caught things kind of early, and I recognised what had happened, and I started wearing earplugs. And for the most part, things started to settle, and I was more sensible for a little while. And I was a fool, because I wished that I'd stuck to that sensibleness and that and being careful. Because although I've carried on wearing earplugs and things, I carried on going to nightclubs, and not always would I wear ear protection. Sometimes I'd go clubbing without them, and what I noticed was that I would then start to get really bad flares of tinnitus that would be really loud. It would be louder than the television, louder than what people were saying to me, and that would flare up after going clubbing and last maybe the whole weekend or 3 or 4 days, and then slowly settle back to baseline. But that baseline, it was changing over time, so there was always a background level there then. It was maybe getting worse incrementally with each time I went clubbing. So I had to be very careful, and I held back mostly from clubbing, but I couldn't avoid it, or I could have avoided it, but I didn't avoid it altogether. In terms of the hearing loss, maybe a couple of years ago was when I started to notice that I couldn't hear what people were saying if they were whispering. So if I was in a lecture and someone would whisper a remark to me, it would pass me by and I wouldn't be able to pick it up. But that wasn't such a big deal, and it didn't really concern me, and for the most part I felt like my hearing was pretty much preserved. I could hear pretty well what people were saying to me in noisy environments and things, fine. But then I went out drinking and had like a double weekend. I went to see Wheatus, awesome band, and I put my earplugs in and I was pretty much fine. Then the next night I did a double whammy and I went out clubbing and I was drinking. And one of the things about drinking is that you take risks and you're not sensible, and I didn't take my earplugs. And it was a really loud, like 5-hour night of heavy metal music, and it was a great laugh. But that's when I really have damaged my ears. And the tinnitus was terrible the next day, but the hearing really took a hit. Now, one of the things that you'll notice when you go to a really noisy night out is that your hearing will dampen down for a couple of days. And that's called a temporary threshold shift. And that's a protective mechanism. It's kind of a sign that you've been exposed to very loud noise and your ears kind of shut down a little bit, protect, and start like reparative mechanisms, and it's part of your ears' protection against loud noises. Now, what I was noticing, that the temporary threshold shifts were progressively getting worse and taking longer to settle back to normal. And this particular night out, the threshold shift took days and days to get anywhere near normal. I couldn't hear what people were saying properly when I was at work. I was really struggling and very stressed out from it. And basically it's never got back to normal. It's not got back to a kind of hearing that I could consider to be good or advisable. And this is the really upsetting part of things, is that my hearing is now left damaged, permanently damaged probably. The way that my hearing is at the moment is that I can hear people fine in quiet environments. I can hear people fine at a relative distance, but I start to struggle if it's softly spoken people, or and I'm probably worse with women than I am with blokes. But blokes tend to have deeper voices and maybe talk a bit louder. But softly spoken women I struggle with. People who don't talk to me directly I struggle with. So if you mumble something or turn away or you have your back to me, it's possible that I won't be able to pick it up. And then in noisy environments, if I'm at the pub and there's lots of background noise, it will be hard for me to filter out the background noise and focus in on what you're saying. And that's pretty depressing. In fact, that's really depressing. That has been such a hit for me. You start struggling to tell what people are saying, and you fill in the gaps. You respond to what you think they've said, or the other option is that you say, sorry, can you speak up, or can you say that again? And I feel like such an ass having to do that all the time, saying sorry, what did you say, or can you repeat that? And I feel so much self-loathing that I can't hear what people are saying to me, and then I don't want to stop the conversation. But it is bad to pretend that you know what people have said, because if you don't, then your response is inappropriate. You can't just say smile and laugh if they haven't said something that at all warrants that response. I guess the worst part about all this is that I've done it to myself. This is not something that I was born with. This is not something that someone's done to me. This is me just being completely irresponsible with my ears, not protecting my hearing, and damaging myself. And that's the most upsetting thing, that I now have to live with a permanent problem that I could have avoided, that I should have avoided, that I knew the risks about, and I've just caused this myself. So things were getting pretty bad recently, and so I went to see my doctor and I told them about what had been going on. She seemed pretty concerned. She did a otoscopy, looked in my ears, and actually the right ear was very much blocked with loads of wax. And so she said maybe it could all have been caused by wax being impacted in there, which I thought was unlikely. And actually I think part of the downside of using earplugs very frequently is that actually I think that of course causes a risk of wax impaction, because you're stuffing things up into the external auditory canal where all the wax is, and that's obviously going to be causing compaction, compressing it all together and pushing it up towards the drum. So I think that may have had a part to play in that. So I went to well, one of the problems with working in hospital is that I can't find time off. I really struggled to find the time off to get my ears syringed, but I got a colleague to do it at work, and they microsuctioned things out. It was a horrible big mess of wax that came out of the right ear, and I was really banking on that fixing everything. What I noticed was that there was some improvement in hearing from that side, definitely in noisy environments, and also I could hear sounds that I hadn't heard before, like rustling of paper and walking on the floor. There was like higher pitched frequencies there that I was missing out on. But did it cause any fix? Has it repaired my hearing to a normal level? No, not at all. Not really. The problem is still there. So now I've been referred on for an audiogram at the hospital, basically where you put headphones on and they test out the different frequencies that you can hear. And there are a few online free audiograms that I have tried. Most of those say that my hearing is fine, but I presume that they're very gross, all-encompassing, or not very detailed audiograms, and I'm afraid they are going to detect a hearing loss when I go for the real thing. The biggest fear for me at the moment is the treatment options, because if this is all just noise-induced hearing loss, the treatment options are very limited, and the biggest one is hearing aids, and that is such a big psychological thing for me. I can't sleep at night sometimes. I'm really worried about this. If the only treatment they can offer me is hearing aids, I'm going to struggle, and I will probably not go for them. I think I'll really struggle to deal with that. They have a stigma attached to them, definitely, and I know I shouldn't say that, but it's true. They do have a stigma. I don't want to be recognised as being disabled or as having some kind of alienating problem. I know there are some completely in the ear canal hearing aids that are around these days, and they've got their disadvantages and their advantages, but I've been doing lots of research into different things and thinking 1,000 thoughts about where this is going, and it's hard to kind of hold back the anxiety about this stuff. The psychological effects of hearing loss are huge. I can be quite a pessimistic and anxious type of guy, and in my head I imagine just not being able to communicate with people properly, or maybe I won't be able to carry on with my job because I can't hear the patients, or maybe I'll just be single forever. One of the big things is worrying about dates. Will I be able to hear what she's saying? Will it be noisy in the background? Will this screw me up? Will I have to stay single forever because I have this problem? And I know these are ridiculous thoughts, and I should tell myself to relax and that things will probably be okay, but it's very difficult to do that. It's very difficult to know what's going to happen and where this is going to go, and the psychological impact of it is really huge. I don't know if I'm depressed or not, but I certainly have had some very, very dark thoughts about it, and even suicidal type thoughts to make this ringing in my ears stop and go away. But of course I will never do anything like that, but the thought, the pessimism, the depression, the anxiety just mingles in, and of course the time when you're most anxious is when you're at night time in bed, and that's the time when the tinnitus flares up. That's the time when I can hear it the most. It's not there all the time. It's not there when I'm busy, when I'm at work or whatever. I don't notice it so much, but it flares at night, and that's when the anxiety and things kick in. So this is just a little bit about where I am right now with my hearing and with my tinnitus, and as I said, I've got an audiogram in a couple of weeks, and I'll probably do a follow-up video with the results of that and just let you guys know how I'm getting on. But it's a bad time. I am still trying to play music. I was playing some drums today with some friends and put the earplugs in. I even went to see Black Sabbath a few months ago and I put earplugs in, and it didn't seem to be that bad, but I just got to be really careful, and it's hard not to just want to withdraw into my shell and not go out anywhere and not play music again, but that's not an option. So I think I'm also going to be exploring whether I can get fitted earplugs as well. You can get ones that are moulded to your ear shape that really will protect you from bad sounds, and maybe I can then stop further damage happening. But who knows? We'll wait and see what the results are. Thanks for listening.